so I'm first gonna start off with hand hygiene. Hi, my name is Ani. I'll be your nurse for today. We're gonna do a full head to toe assessment. If it should take about 15 minutes, let me know if you have any questions in between.
Okay.
Alright, so we're gonna first start off with what is your name and your birthday?
Juliana McCauley, June 3rd, 2002.
Alright, and I'll just verify that by looking at her wristband. Alright, and do you know where you are right now?
Fordham Hall.
Alright, and who is the president?
Joe Biden.
And do you know why you're here right now?
For a checkup.
Alright, and this just shows her level of consciousness by 4. Do you have any allergies?
No.
Are you in any pain today?
No.
Alright, and I can tell by her physical appearance, she's hygienic, her clothes are appropriate for the weather, and I also noticed when she was walking in, her gait was equal and balanced, her legs and arms are moving in opposition, and she didn't need any assistance coming in or getting on the bed, so her mobility was good. What is your height and weight?
I'm 5'11", 130 pounds.
Alright, and with this information, I would calculate her BMI to see if it's on a healthy scale. Alright, so now I'm going to start off with her assessment. So we start off with the scalp. We're going to look for hair loss, hair distribution, if it's healthy. So right now, do you mind if I touch your hair? Alright, looking at it, she doesn't seem to have any hair loss. Her distribution's fine. Her hair looks healthy. Alright, and looking at her head shape, it looks like normocephalic contour. Looking at the rest of her face, her eyebrows, eyes, nose, lips, and her ears are symmetric with the rest of her face. Her eyelashes are even distribution. She's blinking normally. I'm going to start off first with her eyes. So we're going to assess PERLA. So pupils equal round reactive, accommodated to light. And so by doing this, we're gonna see if both eyes constrict when I put the light in her eye. All right, the other side. All right, and we're gonna check for accommodation. Can you follow this for me, please? All right, and like that. All right, do you wear any contacts or wear glasses? All right, good. So we're gonna go on to the nose. Looking at her nose, has midline, it's symmetric. I don't see any lesions or discoloration. I'm going to look at her septum. It looks midline, and I don't see any drainage that's thick or purulent. Do you mind if you plug one nostril and breathe in and out? All right, and the other side. All right, good. It has good patency, and I don't see any piercings. Her lip color looks fine. A good pink for the rest of her body. And do you mind if you smile for me? All right, her teeth look healthy, symmetric. Can you stick out your tongue? All right, can you puff up your cheeks? All right, and can you open your mouth for me? All right, looking at her tongue is a good color. I don't see any lesions. And can you say ah for me?
Ah.
All right, and when she says ah, her uvula goes up. Then we're gonna do your ears. Do you have any difficulty hearing or hearing aids?
No.
All right, do you mind if you close your eyes for me?
Yeah.
All right, and can you tell me which side you hear this on?
My right.
All right.
My left.
All right, and now I'm gonna look inside your ears. All right, and they all look clean. Well, do you use anything to clean your ears?
I clean them with a Q-tip.
All right, when you go in, does it deep or?
I just do the outside of my ear.
All right, and that's good, proper hygiene. Now I'm gonna take your carotid artery pulse, and I'm gonna do each side, but at different times. All right. And like this, I see that bilaterally it's a 2+ with normal rhythm. And I see that her trachea is in line with the rest of her neck. Can you put your head forward for me, please? Backwards, side to side. Other side, all right. And I see her head and neck have full range of motion. So now I'm gonna just look at her arms really quick. So I see her skin color is even and matches with her race. Her body hair shows that she has good perfusion. I don't see any lesions. I'm going to check your temperature on both sides to see if they're the same. I'm going to take your radial pulses on both sides. All right, and by doing this, I see bilaterally that her pulses are 2+ with normal rhythm. I'm going to look at her fingernails. They look round with a good color, and by checking capillary refill, all right, it should be less than 2 seconds. Can you go like this for me, please? And this, all right, she has no clubbing, which is a good sign. And then check for your turgor. All right, she has no turgor, and if she had tenting, that would be a bad sign. All right, so can you go like this for me? Up, side to side, inside, and go like this, and wiggle your fingers. Right, that shows she has a 5 for range of motion. Can you resist against my force? Go like this, please. Right, good. Other way. Right, and can you go like this? And we're gonna do the same thing with your arms. This, and other way. All right, and that shows a 5+ for muscle strength. Now we're gonna listen to lung sounds. She looks like she's breathing effortlessly, not labored, and not using any accessory muscles, but we're still gonna check. We're gonna check with 6 spots in the front, 1 on each side, and 6 in the back, and we're gonna check in a way we check bilaterally to see if they sound even and normal. All right, so every time I change positions, do you mind taking a deep inhale and breathing out? Okay, raise this arm up for me. All right, other side. Very good. Now the back. All right, everything sounds good. She has a normal rate, and I don't hear any crackles or anything. Now we're gonna do her cardiac system. So we're gonna check her pulses, or her heart rate. So we're gonna start off with the aortic side, which is mid-clavicular, second intercostal space, and move over to the right, and just go down to the pulmonic, Erb's point, tricuspid, and mitral. And when you get to the mitral, which is the 5th intercostal space, you listen there for a minute since it's your apical pulse. All right? So we're just gonna listen now, starting with the aortic on the left side. All right, and the last one. All right, and there typically I would listen for a minute, but for the sake of the video, we're not. So her heart rate sounds fine, normal heart rate. I don't hear anything, no murmurs. All right, and now we're gonna go on to the abdomen. Here we would usually check for skin color, symmetry, but for the sake of video, not. Thank you for laying down. When was your last bowel movement, and was it normal?
Yeah, it was this morning.
Was it normal? Yeah.
Mm-hmm.
And when was your last period?
3 weeks ago.
And is that normal with your cycle?
Yeah.
All right. And have you had any pain?
No.
All right. So first we're gonna auscultate, and we're gonna start off with the right lower quadrant, move up to the right upper quadrant, and then move on to the other side. All right, I hear normal bowel sounds, and now we're gonna palpate lightly. Let me know if you have any pain anywhere. Any pain? All right, good. Everything seems no guarding, no distension. All right, now we're gonna move to the lower extremities. So I'm gonna look at her skin really quick. I don't see any lesions. Check for body temperature. All right, seems good. Her hair is a good sign of perfusion. And then do you mind if you sit up for me over here with your legs dangling? All right, and we're gonna test her full range of motion. So do you mind putting your legs down, up, side, side, twist them around. All right, so that's a 5 for full range of motion. Now we're gonna test muscle strength. So can you resist against me? All right, other side. All right, now for your feet, can you push down? All right, and lift them up. All right, and that shows good sign of muscle strength of the 5+. And now we're gonna take her pulse in the bottom of her feet. All right, and we're checking both sides to see if they're bilaterally, and they are 2+ with normal rhythm. And I think that's all for today. Do you have any questions for me?
No.
All right, so now I would have the railings up, call light on, the bed at the low level, and that's it. And the hand hygiene, always. Thank you so much. Did I forget anything?